Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over a very virulent sort of a microbe, which is hantavirus. Hantavirus has a lot of forms, like Andes virus, which affects the lung. I wanted to start off with this picture of the cycle. So basically, let's start with hantavirus spreads through uh, hantavirus. Hantavirus spreads through scat, and then um, and that leads to harmful hantavirus harm to lungs. But let's start here. More rain means more food. More food equals more mice. Hantavirus spreads through scat, and then inhaled with hantavirus harmful to lungs. So what I'm going to do now is go over some of the symptoms and everything, and this cruise ship cruise ship um, outbreak that took place. So some of the symptoms of hantavirus are since 1 to 8 weeks after exposure, and case fatality rate up to 50%. So a lot of people that contract this experience mortality. So anywhere from 1 to 8 weeks, that's alarming. I've never known a virus that affects that long, although hepatitis B might affect longer. So anyway, early symptoms include fever, fatigue, muscle aches, headache, dizziness, nausea, vomiting, abdominal pain, and the difficult. This is difficult to diagnose because these are so common symptoms that can be caused by many different um, etiology. So, what are the late symptoms? So, cough, shortness of breath, fluid filled lungs. This is more serious. Pulmonary edema and shock. Um, might be going well, and then all of a sudden, um, this can become worse. Hantavirus pulmonary syndrome can become worse. Europe and Asia gets a different type of hantavirus, hemorrhagic fever with renal syndrome in Europe and Asia. And this is even more virulent because fatality rates um, are from from less than 1% to 15%. Um, so depending on that strain, that's what the fatality rate is. Recent updates: cruise ship outbreak in May 2026. WHO May 26 continues monitoring global cases, and these virus remains the only strain with the documented person to person spread. And so, PAHO end of last year issued an alert due to increased cases in the southern cone of South America. Um, so this is kind of what is going on. Some of the diagnostic criteria are serology, IgM, IgG antibodies, and then reverse transcriptase, preliminary chain reaction, which is conducted during acute illness. Um, there is no treatment. The care is supportive, and there's no treatment or cure. Just dialysis for early medical care, improved survival for the lungs, and then intensive respiratory support. Um, so the respiratory hemorrhagic fever with renal syndrome is more serious, and Andes virus is way more virulent. So prevention: seal holes in homes and workplaces, store food securely, clean rodent contaminated areas, reduce rodent habitats, and use protective equipment. So what's one key takeaway that I went over? So it's avoiding rodent exposure. That is the most effective way to prevent hantavirus infection. This is this is cleaning as important as disinfecting indoor areas, currently or previously. And here's the map of this is the Santa Barbara area in California, which I had visited, which here my wife and I had visited. And so um, the red ones are places that hantavirus was found in the survey, and then the green is hantavirus not found at time of survey. And deer mice is the most common offensive agent, um, and they're found in forest, brush, grasslands, and chaparral areas through California. Fever 101 to 104, body aches, chills, trouble breathing. So eliminate rodents disposal of dead rodents using rubber gloves or plastic bags. Spray rodents and traps throughout thoroughly with disinfectant. Please place rodents in a plastic bag and seal the bag. Um, so outside control, cut grass and weeds, trim brush within 100 feet of house, cabin, or outbuildings. So there's a lot of different components you can go through. It's the County of Ventura Resource Management Agency, if you want to look it up. Wood piles, hay, and other materials at least 12 inches off the ground and 18 inches away from the buildings. So that summarizes what I wanted to go over today in this talk about hantavirus. I hope this has made some sense. Thank you for listening.